my name is Anna Kaiser. I'm a student physical therapist with Nova Southeastern University. Today we're going to do GONI measurements, which is just testing your joint's ability to move and how much movement that they're able to get. So is that going to be okay with you today?
Yes.
Also, this recording is for educational purposes and will be viewed by my teacher and some of my classmates. Is that going to be okay with you too?
Yes.
Okay. So first we're going to do hip internal rotation. So I'm going to put this underneath the leg to keep the hips at 90 degrees. I'm gonna have your hands stay like that, planted. We don't wanna have any tilting at the sides, or I don't want your pelvis to move either when you're doing the action. So as soon as any of that starts to move, then go ahead and stop where you're at, and then I'll take the measurement there. Okay, so what this action is just bringing the leg like this, and that's called internal rotation of the hip. So we can go ahead and do that action for me. Perfect. And then I'm gonna line this up. Okay, now go ahead and do that action slowly. And that is 36 degrees of internal rotation. Now we're going to do the opposite direction, so I'm going to have you scoot that leg out, and you're just going to bring that leg this way. Perfect. So I don't want you to lift your leg when you do it though, so go ahead and do it, and then we want to stop there. Go ahead. Stay there, yeah. And go ahead and do that action for me slowly. Are you able to get any more? Okay. That is 16 degrees of external rotation of the hip. Next is ankle dorsiflexion. So that action is just bringing your foot up to meet the rest of your body. Perfect. And start there. Okay. Now can you bring it up any further? And that is 16 degrees of dorsiflexion, and now we're going to do the opposite direction. So you're just going to bring your foot to the floor. Perfect, just like that. So we'll start in that neutral position. We're starting at 90 degrees, just like before. Perfect. So now if you'll drop that. And so that can be seen. And we got to 50 degrees of plantar flexion. Next, we're going to do tarsal joint inversion and eversion. So inversion is taking your foot and going like this, but we want to keep this as stable as possible, which I'll help you to do. Perfect. So that's inversion. Okay, go ahead and do that action. And I'm getting 28 degrees of inversion. And next, we're going to do eversion. That's the opposite direction. Perfect. So let me get that lined up. Okay, go ahead. And we get 18 degrees of eversion. Next, we're going to do hip flexion. So I'm going to have you lay on your back, right, with your head this way. So hip flexion, I'm going to go and run you through that action myself. So you're going to just bend at the hip like this, and we'll just have you lift your foot off of the ground so that you can get as far as you can. But I'll let you do that action. So go ahead and do that action for me. Perfect. Okay, so we don't want to lift, or you don't want to have your pelvis lift or anything like that off of the table so that we're not having any substitutions. Perfect. Yes. All right, so I'm gonna move your arm here just so I can get a good measurement. Okay, go ahead and do that action for me. And we got, sorry, 113 degrees of hip flexion. Now we're going to do hip abduction, so that's just bringing the leg straight out this way. Yeah, swiping it that way, perfect. So now I'm just gonna line up here. Okay, so go ahead and do that action for me again. Perfect, and stop there. We've got 113 degrees of hip abduction. And now adduction, you're gonna move that leg out of the way. And we're just going to bring this leg as close to that one as you can. So go ahead and do that. Perfect. So start same spots. Actually, we're gonna retake that other one that I just did, so you can put your leg back normal. Because we're starting at 90. So go ahead and do that action for me again, or going out this way.
Oh, sorry.
You're okay. Okay, stop there. So correction, 12 degrees of hip abduction. And then now let's move this leg out of the way so that you're free to move. All right, now go ahead and bring it in. And we got 14 degrees of hip abduction. And now we're going to do knee flexion. So what you're going to do is just bend your knee. And you don't have to bend too much of the hip, but we just want to make sure you get as much as you can actively of the knee flex. Perfect. Okay, go ahead and do that action for me again. And we get 128 degrees of knee flexion. Now we're going to do knee extension. I'm going to just tuck this underneath your ankle. Perfect, like that. Okay. If you're able to, can you sink that back of your knee into the table any further? And we got 4 degrees of knee extension. So now I'm going to have you roll onto your stomach and we're going to do hip extension. And that's just bringing your leg straight up to the ceiling, but you don't want to have your pelvis or you don't want to have like your hips come off of the table, and you don't want to bend at your back or anything like that. So that would be called a substitution, and we don't want to do that. So go ahead and do that action for me. Perfect. Okay. Okay, go ahead. And I got 13 degrees of hip extension.